Welcome to Bonnie's Beat. I'm your host, Bonnie Squires. We're coming to you from Radnor Studio 21 in beautiful downtown Wayne. We'd like to let you know who's doing what to whom in important positions in our community. And today we have a very interesting person that I've known for a long time, Dr. Sherman Leis, who is a surgeon with a terrific specialty, interesting specialty, especially these days, right, Dr. Leis? The sexual reassignment surgery, is that what you call it?
Well, we call it transgender surgery, but it is sexual or gender reassignment surgery.
Gender reassignment surgery, okay. Especially timely since Vanity Fair came out with that gorgeous photograph on the cover of the person who was now Caitlyn Jenner. And you have a philosophy about people who feel that they were born into the wrong bodies.
Well, it's not my philosophy.
Oh.
It's a medical fact that there are a certain percentage of people, and we're not sure what that percentage is, but it's a fairly large percentage. It might be as high as 5% of people in the country. It's certainly accepted to be 1 or 2% of people in the country who are born with the emotions and the mentality of one gender, but they're born into the opposite body, the body of one gender, mentally and emotionally the other gender. And that presents a problem because they grow up being a little confused, being mistreated, being discriminated against, and they don't know why. But as they grow up, it becomes more and more clear. And usually it becomes clear relatively early in life. 2, 3, 4, 5 years old, they're very certain that they are one gender, the gender opposite their biologic gender. And that creates a whole set of problems. So those that are fortunate enough to have parents that are a little bit educated about these issues and bring them to proper evaluation. Many of our children's hospitals in the United States, like Children's Hospital here in Philadelphia, CHOP, Boston Children's, Cincinnati Children's, Los Angeles, Washington, are now opening gender identity clinics.
Interesting.
And then they get evaluated by pediatric psychologists and psychiatrists and evaluated by pediatric endocrinologists for their hormone level evaluations. And if they're deemed appropriate patients, they're watched. The treatment is now to not do anything in the beginning, but let the kids grow up. Let them decide what clothes they want to wear, what haircut they want to have. Speak to their schools, arrange for gender-neutral bathrooms, or let them use the nurse's bathroom when they're kids, but let them come dressed the way they want to
It's
dress.
interesting you said that because recently on television, and I don't remember if it was 60 Minutes or it was the evening news, there was a long segment about parents of a kid, I think it was only like 14, was already having gender reassignment surgery because they said that their daughter from the age of like 2 insisted on being called by a boy's name, insisted on dressing like a boy, insisted on playing with boys, and she hated her body. She just said that she was in the wrong body. And people can question why you would have a child, an early teenager, have surgery. Have you ever done surgery on an early teen?
I think the earliest teens that have been done have been 16, and I think that show might have been one that a patient of mine was on, a little girl by the name of Allie Bradley, who came down with her father from the Boston area, referred by the Boston Children's Hospital, Dr. Norman Spack, who's like an authority, a world authority. He opened up the first pediatric gender identity clinic at Boston Children's. He's on the staff of Harvard and Massachusetts General. He and the head of psychiatry of Harvard and pediatric and adolescent psychiatry at Harvard and Boston Children's referred that patient to me, who had identified as a female since she was very, very young. She's a lovely, lovely girl. And she was, her story was told on CBS, a CBS special news a few months ago. That might be the one you're referring to. I don't know if anyone that's been operated, at least that had the genital reassignment surgery at age 14. I think 16 is about the youngest, although it'll probably get a little bit younger.
So you did a gender reassignment from a boy to a girl?
Yes, male to female at age 16. I've done a few now, and I'm doing another one, I think, next week.
But that's a lot easier than making making a female into a male, right?
A little bit less complicated, yeah, a little less complicated. There are other issues. They're both complex surgeries, but there are a few other more complicated options and considerations when we do female to male.
Let's go back to the Vanity Fair cover, because it was all over the Twitter universe, every television station, newspaper, magazine, radio show. What was your reaction? I mean, you've never met Bruce Jenner or Caitlyn Jenner, have you?
No, no.
But you've read a lot about them.
No, I met Chaz Bono, and I'm in Chaz Bono's documentary a couple of years ago, and that made a lot of news too. But I don't know Bruce Jenner. We don't know each other. But I'm glad that that there's some fairly good PR. I think it may be a little overdone by now, but anyhow, there's a lot of PR about it, which in the long run to me is good and healthy. Why? Because it educates people. People that never thought about the transgender issue or who had very fixed ideas about trans people now have their minds opened up a little bit if they at least take a few seconds to listen and pay attention to these interviews. The interview with Diane Sawyer a few weeks ago was terrific.
That was, well, it's very interesting because Bruce Jenner and the Kardashian clan, they know how to make money. Oh my God. But in April, he did that interview, and you could see that he had already had a lot of facial plastic surgery, and I guess he had been on hormones for years, right?
I don't know how long, but I think for a while he had facial feminization surgery and breast augmentation. Is not interested at this time in what we call bottom surgery or genital reassignment.
Okay. And then 2 months later, there's the cover of Vanity Fair, and Annie Leibovitz photo. And as my hairdresser said to me, Bonnie, you could look that good if you had as many professionals working on you with hair and makeup and dressing and a stylist and whatever, you know. But they were gorgeous photos, all of them in the whole issue. George Strimmel, who runs Radnor Studio 21, loaned me his copy of Vanity Fair because I must have gone to 20 different drugstores, pharmacies, supermarkets, and I went starting the day that they announced it was supposed to be available. I've never seen a copy on a newsstand. Have you?
No, but I've seen pictures of that photograph of that front page.
Oh yeah, that was all over the internet. But I've never seen the actual magazine except the people who subscribe. So George is a subscriber, so he loaned me his copy. And Caitlyn Jenner is gorgeous, but she had 10 hours of facial surgery.
I was going to say, the earlier pictures I saw of her some months before, shortly after her facial surgery, which I didn't think was the best in the world, and I'm not sure if the surgeon that did it does much transgender work, had decent surgery for a plastic surgeon, but we do things a little bit different in our transgender patients in the form of feminization, not just to make a cute nose, but a feminine nose and a natural nose and other facial features, the square jaw we have to redo. And all of this wasn't done for Caitlyn. Of course, and a lot of people have asked me this, and I tell them, look, if you have a half a dozen professional makeup artists working on you for several hours.
Yes.
You have one of the top photographers in the country.
Yes.
And then on top of that, they airbrush your photos. Right. I mean, you can make a monkey look good on television, you know, with a picture like that. I would look good. Anybody could look good when you have that kind of attention. So, of course, the front page of Vanity Fair, anyone on that front page looks pretty good by the time they get done with you. But anyhow, she still looks feminine now, and she wants to be accepted as feminine. She's changed her name legally, I think, to Caitlyn, and she wants to have a feminine life, except she doesn't yet want to do the genital reassignment. So in a way, some people ask me, hey, she wants to be a girl from her waist up, but in bed she wants to be a guy, and she wants to still date women.
Really?
She wants to date women. She said, look, she still likes women, and actually a lot of trans male to female patients do. They remain interested in women, and a lot of them marry women. They have a same-sex marriage then.
Isn't that interesting?
And marry women. I know a number of people, and a couple of my patients have done that also. Now,
we can put this on the screen. Dr. Leis was kind enough to bring along some photos. The man on the right felt that he was born into the wrong body, and on the left is that man as a transgender, as a
Right.
woman?
Well, I don't think of her as a man. I think of her as a woman
okay.
who was a transgender woman and knew she was really a woman in her mind and her heart for almost all of her life. And at some time during her adult years decided she's going to transition. She's not going to take it anymore. She's going to live the life she wanted to live. She wants to be the lady and the woman that she always wanted to be. And so she transitioned. She got mental health support, evaluation and support, and clearance for surgery. And she was on hormones for some years, female hormones. They take estrogens and sometimes male hormone suppressants, spironolactone. It's an aldactone that suppresses the male hormone and permits the estrogens to work better, and so you can feminize better in all the different ways of feminization. And finally started doing surgery. Had facial feminization, and there are her photos. Then had breast augmentation and had genital reassignment. And that individual is a very happy individual now. She had been living with a partner, I don't remember whether it was a male or a female partner, for some years, and they stayed together. Most marriages, she may have even been married. That was about a year ago. Many of our patients are already married, and at least half of them stay married. And the rate of divorce is about the same as the rate of divorce in non-transgender people, interestingly enough.
I remember, I don't know how many decades ago, was the first one I became aware of. Well, there was someone named Christine who went to Denmark for a sex change operation maybe 40 years ago.
Right, that was Christine Jorgensen.
Christine
was an American
Jorgensen.
GI that was operated by a surgeon who I knew because I trained in Sweden, and we used to go visit him sometimes in Copenhagen. He was head of a plastic surgery unit in Copenhagen. Very nice man. We didn't talk about that at all in those years, but turns out he was the one that did Christine Jorgensen. She was by far not the first patient, but she was the first one that went public with it in the United States. She had a stage show. She sang and told stories and was a raconteur. And of course, they publicized her surgery because then thousands of people wanted to come and see her. They just wanted to gawk at this a sex change surgery. It was unbelievable. And so she was sold out. Her show was sold out for the rest of her career. She had a terrific career. And from what I understand, she was a pretty good singer anyhow. And she was attractive. She became a fairly attractive female, sang nicely, told some stories and jokes, and I guess talked about her gender reassignment, and had a tremendous career for the rest of her life.
I remember reading articles in the newspaper about a school teacher named Paul Goodman, who was married and had children, but always believed that he was a woman. And he had sex change gender reassignment surgery. His wife stayed with him. He changed his name to Paula Goodman, and they let him continue teaching. But I would think it'd be a little confusing for students that they come back in September and Mr. Goodman is now Mrs. Goodman.
That's right. And people, and I've done lawyers and doctors and dentists, and most of them maintain their professions. They might lose one or two clients or patients, but for the most part, when they explain it to their patients that and they start dressing as a woman in their office, that they're transitioning, that they're transgender. If they present it to them in a rational way, in a way that the people can understand, most people stay with them, and they continue their careers. I've operated on many people that have maintained their careers and might have a few little problems here and there, but for the most part, they've done all right.
You mentioned Chaz Bono. That's Cher's
Right.
daughter, Chastity,
Right.
who always believed that she was born into the wrong body
Right.
and transitioned to Chaz, a guy. I may even be married now, I'm not sure.
I don't know.
But what relationship did you have with Chaz Bono?
Well, it must have been 3 years ago. I was lecturing and doing consultations at a large transgender convention meeting in Atlanta called the Southern Comfort Conference. It's one of the top conferences in the United States for trans people. And a number of doctors come and give lectures, and psychologists, and all types of people come, and they have all types of workshops there. Well, this is at the time when Chaz was coming out, and he came to that meeting. And I didn't know it at the time, but sat in on my lectures on female to male transitioning, facial surgery and top surgery and bottom surgery. And after the lecture, and I saw someone was filming my lecture in the back of the room. And after the lecture, Chaz threw a party for everyone, about 300 people. He seems to have unlimited funds and doesn't work from what I understand. Just, I guess, inherited a lot of money from his parents.
From Sonny.
From Sonny and Sherry. Threw a big party, and his people, because he came there with a couple of cameramen and a publicity person, because they were doing a story, they were doing a documentary, and they wanted me to come over. They asked me to come over and say hello to Chaz. Chaz was in my lecture and wanted to meet me. And well, we got together and we chatted for a while, and they had that on film. And later, his people came to me and asked if they could use some of this material on Chaz's documentary. So I said, sure, why not? They did. So they sent some papers to my office, some legal papers to sign, that release that we could do that. And they actually took part of my lecture and they put it on his documentary.
Oh, wow.
And they took part of our discussion that we were standing there chatting. And he had at that meeting, he had a book signing party. And there were long lines of kids there that were there to attend the meeting who were waiting in line to buy his book for, I think, $40, and he would sign it and say a couple of words to them. And it was that's one reason he was going around to these meetings, and also to learn about potential surgery. As far as I know, Chaz never did the genital reassignment.
Oh, really?
Never did the genital reassignment. He had what we call top surgery. He had bilateral mastectomies to give him a masculine chest. I don't think had any surgery of the face. But of course, when a female takes testosterone, they grow a beard. They have to shave, or they can grow a mustache or a little beard if they like. And they get hairy arms and chest. And if they work out a little bit, I don't know how much working out Chaz does, kind of chubby, but maybe he'll lose some weight by now. But if they work out, their testosterone that they're taking as a supplement helps them build bigger muscles, so they really develop a masculine body. And sometimes they get bald, especially after they're on testosterone. They get a little bald and high widow's peaks, male pattern baldness. So they really look masculine because of that and the beard. And if they wear guys' clothes with a collared shirt and guys' clothes, they look masculine. So most female to male transgender people do not do facial masculinization, as opposed to the male to females who many of them do facial feminization. I do a lot of that. This patient that we showed earlier is just one example of that, but I do a lot of that. Every week I do 1 or 2 faces, 1 or 2 chest surgeries, 1 or 2 bottom surgeries. But almost all, male to female and female to male, but almost all the faces are male to female.
When you look at the Vanity Fair picture, I remember reading an interview with Buzz Bissinger, who spent 3 months with Caitlyn Jenner and then spent a month writing the article. And in the interview with Buzz Bissinger, excuse me, he said that Bruce Jenner, Caitlyn Jenner, expected to have 5 hours of facial reconstruction, and it ended up being 10 hours of surgery. I personally don't believe in volunteering for pain, and any of this surgery has to be painful afterwards, yes?
No, not necessarily. I disagree
Oh,
with you.
says Dr. Sherman.
Well, sure, I do a lot of it for all kinds of people for many years. And we have such good medicines today that we give during surgery and after surgery that patients really are fairly comfortable. They're a little swollen and puffy, so you feel a little tight and swollen, but there should really be no serious pain at all after any of the surgery, including the genital reassignment. We can keep them pretty comfortable.
There have been a lot of articles that say in the transgender community there's a very high incidence of suicide. I don't know if that's before they are, they change identities or after.
Absolutely. There's a very high incidence of depression to begin with, and they have reason to be depressed because they're frustrated most of their lives themselves, and on top of that, they're discriminated against and mistreated and sometimes beat up, sometimes killed. There are usually a couple of murders every year, like people go kill gay people just because they're gay, some rednecks in Arkansas or, some places that are mainly uneducated people that are, that just have, they see everything black and white, and you're gay, you're done, we'll beat you up. And they're that way with transgender people. In the more educated communities, that doesn't happen. But it's true that I would say the majority of transgender people suffer with depression, hopefully for which they're being treated. And there's, unfortunately, also a very high incidence, it's 40 or 41% of suicide attempt I don't know how many commit suicide and
40%.
who are successful, but a 40% rate of attempted suicide is terrible. But I can tell you, once they get proper treatment consisting of mental evaluation and therapy if needed. Everybody doesn't need therapy. Some people are pretty well. They just have to need support. Hormonal therapy, taking the appropriate hormones and hormone suppression until this genital surgery, that triad of treatment has been proven over and over again to be the successful and accepted way by all the authorities in the world of managing a transgender patient. And once they do that properly, not take hormones through the mail that they buy from Canada or China or Mexico, not to go to who knows where to get their surgery, who will just do it as soon as you pay your money. They'll do it no matter, they'll do anything you want them to do. But not that type of surgery. Legitimate surgery by legitimately trained quality surgeons and good endocrinologists taking care of them and good mental health support. Those people, the rate of depression and suicide attempt is dramatically altered, drops way, way low to just slightly above the average person.
Well, now, when Sherman Leis was a little boy, I don't think he said, I want to grow up to be a doctor who changes people's gender, because it probably wasn't even heard of in those days.
Of course not. I never thought of that. I wanted to be a clarinetist. I wanted to play clarinet. That's
well,
what I wanted to do.
You are a musician.
I still play the clarinet, yes.
And you're also the director of the Lower Merion Symphony Orchestra?
Yes, well, I'm the president and CEO of the Lower Merion Symphony. Our musical director and conductor is Mark Gigliotti from the Philadelphia Orchestra.
Okay, but you've been the president for a long time.
Well, I founded the orchestra about 20, 25 years ago.
Okay.
So I'm still hanging in there and trying to keep things together and make sure we have good concerts and try to make the orchestra better and better every year.
Where'd you go to high school?
West Philly High.
And where'd you go to college?
Rutgers, the State University of New Jersey.
And where'd you go to med school?
Medical school, the Philadelphia College of Osteopathic Medicine. Then I took general surgery residency at Metropolitan Hospital in Philadelphia and at Albert Einstein Medical Center here in Philadelphia. I'm going to give a talk there soon to the staff. And then I had fellowships in Europe, in France and Sweden for 2.5 years with fabulous surgeons in both Paris and in Malmö, Sweden, at the University of Lund Hospital in Malmö.
Do you speak French fluently?
Oui, madame, oui.
Well, see. Okay.
Oui, bon.
Well, then you have to go see the Impressionist exhibit at the Philadelphia Museum of Art. There are 98 of the most spectacular French Impressionist paintings that they've collected from museums and private collections around the world.
Well, of course, we have the Barnes Foundation in Philadelphia, which is supposed to be the top collection of Impressionistic painters in the world. But of course, they can get more and do it at Philadelphia Art Museum, too.
Well, but these 98 paintings, they're paintings that have never been seen together before, except in this exhibition. And there are 3 major museums that collaborated on this. Philadelphia Museum of Art, the Musée d'Orsay in Paris, they showed it at the Luxembourg Museum, and the National Gallery of Art in London. But when you see 3 of the Renoir dancers, 2 of them I had seen many times at the Musée d'Orsay in Paris. But now they've got the 3rd one hanging in the middle, and that's from the Boston Museum of Fine Arts, which I'd seen decades ago.
It's a fabulous place, that Boston. I've been there.
Yes,
It's a fabulous place.
Decades ago. But to see them hanging together, and then there's another room. Well, we won't talk about that'll be for another show.
A plastic surgeon's father was a curator of that magazine, of that Boston Art Museum.
Oh, really?
I just thought of it now. I forgot it again.
That's okay.
Oh, my fabulous guy. His son was a famous plastic surgeon up in Boston.
If people want to contact Dr. Sherman Leis at the Center for Plastic and Reconstructive Surgery, let's put the phone number on the screen, 610-667-1888. That's 610-667-1888. And your webpage is www.dr for Dr. Sherman Leis, LEIS.com. Do you ever do any pro bono surgery? There must be people who are desperate that can't afford to pay for the surgery.
I do, but in a limited fashion because I can't afford to do them in private practice. People who can do pro bono surgery, and by the way, it brings up an interesting subject. I do an occasional case. But private surgeons can't do much pro bono work. I don't work for a big firm where I get the same salary regardless of what I do. But surgeons who are full-time salaried people at university hospitals, it doesn't matter what any one patient pays because they get a salary. They can accept Medicare and Medicaid, which now pay for transgender surgery.
Oh, really?
So when it was about less than a year ago, Medicare decided to accept it. Obamacare pays for it, which is really Medicaid, pays for it. Our office was flooded with phone calls. Oh, thank God. When can I sign up? I want to sign up like next week. I'm already booked up a year in advance, but they want to sign up next week for surgery because now my Medicare will pay for it. Well, sorry, but we can't accept what Medicare or Medicaid pays for surgery. Medicaid pays about 1%. I think they pay $300 for this huge operation. And Medicare pays usually 5 to 10% of a normal surgery fee. But there are 1 or 2 places in the country, they're probably all booked up now, where the plastic surgeons and urologists probably get together and they'll accept an occasional case and maybe build up a transgender service in those places because the hospital makes enough money. Medicare and Medicaid pay fairly well for the hospital and the operating room. They don't pay doctors very well, but they pay the facility well because they have contracts. They have to pay at least their overhead.
Okay.
So the hospital makes enough money from the hospital bill and the OR bill that still covers the surgeon's salary because he does other work that'll bring in enough money to pay his salary.
You said you went to the Philadelphia College of Osteopathic Medicine right on City Avenue.
Yes, that's where it is now.
And you also told me that it's one of the largest med school classes
I think
in
it's
the
the
country?
8th largest medical school class in the United States now. It's a very large school, a wonderful school.
Very interesting because it's virtually the same medical education as you get at the Penn, Jefferson,
Absolutely.
Temple.
Absolutely.
Interchangeable. That started a long time ago with, he's now gone from us, but Dr. Irv Berkowitz went to the osteopathic school.
Yeah.
And then he ended up doing his residency under Ravden, the cancer specialist at the University of Pennsylvania. He was the first DO that they ever accepted at Penn, and he opened the gates for other, osteopathic physicians.
Yeah. Now the state boards are the same. People take our national board exams. DOs and MDs take all the same national exams, the COMLEX and all these national boards. They're partners. They're in partnerships with allopathic groups. The head of cardiovascular surgery at Lankenau, a local hospital, Fran Sutter's at DO. He's was chief, I don't know if he is now, but he was chief of cardiac surgery there. He developed robotic surgery, bypass surgery.
Wow.
My own brother had robotic heart surgery there. A terrific guy. But DOs are now in all the medical institutions, and they're very much the same level as our allopathic brethren.
Do you ever arrange reunions from your patients?
No, I haven't done that, but I see them. We sort of have little reunions at the different transgender meetings around the country. I speak at maybe a half a dozen of the major transgender conventions around the country, and a lot of our patients meet there.
Very interesting. What do they give you as a thank you, your satisfied patients? They send you a fruit basket?
Who, the meetings that I attend?
Your patients.
Oh, you should see the beautiful letters that I get. I'll tell you, my patients love me. I love them. I've gotten to know them very, very well because for the couple of weeks that they're here in Philadelphia, and they come from all of the United States and beyond, we get to know each other pretty well because I see them every day, once or twice a day, for the couple of weeks that they're here. And you should see the absolutely beautiful letters, so meaningful. That's an enormous reward. I can't complain, I make a nice living doing it, but that will stay with me forever. And that's a legacy that I know I'll always have, and that I've been training residents too, not only in plastic surgery, but in transgender surgery too, because we need more surgeons. We don't have any formal training programs in transgender surgery, and that's a big need, because there are more and more people that are demanding and wanting this surgery all around the United States and around the world, in fact. We need to train more doctors.
Our guest today has been Dr. Sherman Leis, who is really a pioneer in performing transgender gender reassignment surgery. So thank you very much, Dr. Leis, and we'll see everybody next week.
Pleasure to be here.